So Mike, thanks so much for coming in and like sharing your story with us. And I felt like I wanted to have you do this video because you're a really great example of someone that has an urgent problem and how we dealt with it with dental implants. And so the story is wonderful, and the phone call that I got from you. So I'd love for you to tell me how it was what happened and what prompted you to call.
Well, my wife and I were in the middle of New York State, and I was having lunch on our way back, and bit down into a BLT, tough piece of bacon.
Boom.
Boom, and the tooth broke off right at the gum.
And so it was a tooth right in the front, right?
Yes, it was.
Right, okay.
Yeah. And so, since I'm a guy that usually smiles a lot, really had an impact on my face.
Yeah, so it's important to you that this get taken care of promptly.
Absolutely.
Yeah.
Absolutely. Yeah. So, on our day way back, I called your office. You said, can you be in here at 8 o'clock on Saturday morning? And this was Thursday afternoon.
Yeah.
And I said, certainly.
Yeah.
So I was here, took a look, did the procedure, put the implant in, put on the temporary cap, and I'm smiling again.
You're smiling again. So Mike, your case was interesting because oftentimes when we can remove a tooth and place an implant that same day, we can sometimes put a temporary on it. Not always, but in your case, because you had the bone there and you had everything that all we had to do is get the root out of there carefully and place a dental implant in there and then make a temporary. And so you were a perfect candidate for what we call an immediate load dental implant, where we take the tooth out, place the implant, make a tooth on there. And so we were able to give you a temporary that day, and now we just have to go through the healing time of about 4 or 5 months. One of the questions that we get asked a lot from what phone calls that we get is, and this kind of doesn't pertain to you, but it does, dentistry, especially implant dentistry, is very, very expensive, and people have to see value in it to make that financial decision. And obviously in your case, you had a good tooth on either side of the broken one, so your options were to do a fixed bridge where we cut down the teeth on either side of it, or place a dental implant. So tell me why you decided, why your option was the dental implant.
Well, I didn't want a bridge, first of all. Second of all, the implant to me was the best route to go.
Yeah.
It was a frontal tooth, didn't see any other way out.
Yeah.
And like I said, a bridge was not going to be part of that action, so that's why I went the way I went.
Right, you didn't want to touch the other teeth because you felt like they were still in good shape.
Absolutely.
Yeah. And so from a value standpoint, you felt like, you know, as long as I can afford this tooth, fit it into my budget, it's the thing that I want to do. Is that correct?
That is true. The cost is always a concern, but
of course,
under the circumstances, I wanted it done, and I wanted it done right.
Yeah, yeah.
And you did a great job.
Thank you very much. And Mike, you've been a patient of mine for many years. I appreciate the trust that you give me, and we're going to finish this up in a few months, and you're going to get a nice tooth in the front, and then stay away from the bacon bits, okay?
Oh, darn.
All right, all right.
Definitely.
And thank you very much for sharing your story with us.
You're welcome. Thank you, Doctor.